Hi, Dr. D here, and we're going to talk about pulse electromagnetic field therapy or treatment. But before we do that, I want you to think about this. In this day and age, nothing's more annoying than having your cell phone losing its charge and not having access to all the things you need. Now, what's more annoying, but you don't realize it, is your cells losing their charge of their membrane and them not functioning at the level they need, whether it be a lung cell, muscle cell, heart cell, liver cell, ligaments, cartilage. All of those cells have a healthy charge that needs to be maintained for those cells to create energy, get in nutrients, and get out waste products. But certain things that happen, whether it's an injury or repetitive stress issue, or it's a disease process, or just a cellular weakness, can create illness, pain, discomfort throughout your normal day. Now, pulse electromagnetic field therapy is actually a cellular exercise treatment, just like exercising your muscles, for all of those cells. So I want you to think about this though. So these grapes and these grapes. Now, these grapes are cells that have lost their charge. There's not a lot of nutrients in them. There's not a lot of health in them. They're dehydrated, and they're not essentially, let's say, communicating with the other grapes as a cellular level. Now, what PMF does is takes these grapes, recharges them into these grapes. There's better nutrients, there's better energy, the membranes of the cells are healthier, and you're getting more nutrition out of them. Another way to think of PEMF is this flashlight. The batteries are dying. You can see the light is very dim. It's still functioning as a flashlight, but very poorly. Now, what PMF does is recharges the batteries, so now the flashlight returns to this level and is a higher functioning flashlight. Now, PMF cellular exercise is applied several ways. These rings send an electromagnetic current down from the wire into your cells. So if I had a medial knee injury, whether it was a ligament, a bone, arthritic degeneration, or the muscle, I can recharge those injured weak cells so they come to a healthy level, they start producing more energy, and they start functioning at the level that they need. And the byproduct is your body starts feeling better, you start moving better, and the cells are exercised. Now, we can put this on the elbow. This whole chair is a PMF system where we can sit back and I can work the shoulder as well as working the full body. I've put PMF on everything from ankle sprains to low back disc injuries to respiratory bronchitis issues. I had a patient who had post-chemo fog 2 years after getting chemotherapy, and with the PMF and some other therapies, we were able to get her life back and her health back. So pulse electromagnetic field therapy is a very powerful therapy that we utilize in the office that we're going to have you try. I'm going to have you watch some videos after, show you pre and post examples of how PMF works. Okay, so this is February 12th. This is Sophie Dubreel's ankle. She just had a bad sprain. So go ahead, Sophie, just lift it up. And now push it forward. And that's her range of motion right now. All right, so this is February 13th. This is Sophie range of motion after one PMF treatment yesterday. So lift your toes towards your head. Lift your thighs, you can go. There you go. Now press your foot down as far as you can go. Excellent. Good job. This is February 16th. This is Sophie. So she's able to do some weight bearing on it. Walk to me, Soph. Okay. Okay, lift the toes towards your head and flex forward. Good. Okay, good. Excellent. This is February 16th. Sophie's had 3 PMF sessions. So this is actually Sophie, who owns the foot we've been working on. So here's her ankle, and this is going on, I think, just the 4th PMF session. Lift your foot all the way up towards your head, as far as you can go. Excellent. Push it all the way down. Good. And then just take it, Soph, and want you to just to turn it in a little bit and turn it over. All right, how's that feeling?
Hurts more this way than that.
A little more in way, but up, back, and forth, it's feeling good? All right, good. And you were able to walk with a shoe today or yesterday around the house, you said? All right, fantastic. All right, this is February 24th. Soph's doing good. She's back in a shoe. She was able to put a brace on with her basketball shoe. Just go ahead and stand on one foot. Let me see. Good, excellent. All right, have a seat here. Bring that foot up. All right, go ahead and bring it all the way up, all the way down. Excellent. And go here, bring it up, turn it in and out. Good. How's that doing? Good. Like you said, just a little bit of pain when we go in, right? Excellent. All right, so this is February 26th. Sophie's been treated for 2 weeks with a moderate to severe ankle sprain. So we're gonna do some muscle testing. So hold your foot up, Soph, don't let me move. Good. Push into me. Good. Hold your foot here, I'm gonna push that way, hold. Good. Push it, I'm gonna push that way. Don't. Any pain with that? Okay. All the way down, all the way up. Nice. Then bring it in, out. All right, how are we doing? Any pain? All right. And she's heading back to basketball tomorrow. And you practice this weekend?
Mm-hmm.
How'd you feel? Right. Jason Thornton, extend back for me. And come back to neutral. Bend forward as far as you can go. If it hurts, let me know.
Right there.
All right, come on up. And what's that pain level, Jason, when it bend forward and backwards?
It goes to about a 6.
Okay. This is Jason, 5 minutes after PEMF. All right, extend back, Jason. Okay, come on back. Look at me here. Any pain with that?
No.
No pain. So that was 5 minutes, and he has no pain with extension, and he was at a 6 out of 10. All right, we're gonna do 5 more minutes. All right, this is Jason after a total of 10 minutes. Extend back, Jason. Okay, back up. Still no pain. And flex forward, Jason. And back up. That's the first time you touch your toes in how long?
5 months.
Yep. All right. All right, this is Kevin Drab. This is October 3rd. Kevin injured his right shoulder on the bicycle fall. So Kevin, go ahead and move your arm out to the side. Tell me when it hurts.
Starting right here,
Okay.
tight.
And bring it up as high as you can go and where you can't go further. About right there?
Yeah,
Okay. What's the pain level or stiffness level?
very stiff and 60% pain.
Okay, bring your arm down with your thumb out to your side. And I want you to bring your arm out and tell me when it hurts. Bring it all the way out and go. Keep going.
Starting to feel tight right there.
Okay. Keep going as high as you can go and stop when you can't move it high.
that's-
Right there?
Yep.
Okay. And down. Okay. All right. So this is after 10 minutes of PMF. So go ahead. Remember, just lift that arm right to the side. Go ahead. Up. How's it feeling?
Little pain right there.
Okay.
Just the same.
Excellent. All right. Down. Thumb to your side. Bring that arm out to your side.
Little tightness right there.
Keep going. All right. Good.
Yeah, it's tight.
All right, and down. All right. So this is Kevin's treatment the second time. He only had one PMF session. We're about to get his second, but go ahead. Turn your thumb out, Kevin. Bring your arm out to your side now. All the way up as high as you can go. Excellent. What's the pain level right there?
Like a 3.
All right, down.
It's tight.
Yeah. All right, fantastic. All right, this is Kevin after his second PMF. Turn that thumb out, Kev. Bring it all the way up as high as you can go. Keep moving it. Keep that arm straight. Move it. Keep going. High as you can go, brother.
Holy cow.
And back down. Now, first day you could only go up about 30 degrees.
Yeah.
There is all you had. This is 2 treatments. We got full range of motion back. What pain level was it at the top?
Just a little uncomfortable, not much.
Awesome. Fantastic. This is Lee getting off the table. Remember I told you to spin?
Ow.
Gotta spin those legs.
Trying.
All right, ta-da. So this is the first, this is before you start your PMF sessions. That's how you're getting off the table.
Oh, yeah. Like,
And this is January 7th, 2019. All right, come on up, Lee. This is Lee after her.
wait a minute, because
Yeah,
it's
pull that off.
my face.
All right, just come on up.
Okay.
Remember, spin, spin, spin. And stand up for me. Is that the quickest you've ever got off the table?
Oh, yeah.
All right, and so 1 PMF full body treatment, and that's the quickest you've got off the table. And we've been treating you for about 5 weeks.
Yeah.
And usually you complain like crazy getting your feet underneath you, don't you?
Yes.
Yeah, so you're able to get your feet underneath you, stood right up, no issues.
Yeah.
All
I'm
right,
smiling.
1 session, yes, that's awesome.